Ladies and gentlemen, please welcome Dr. Vanessa Carey of Seed Global Health and Melissa Brotz of Abbott.
Ooh.
Good morning. I'm Melissa Brotz. I'm president of Abbott Fund, the foundation of the global healthcare company Abbott. I'm also head of global marketing and external affairs, where I lead the company's sustainability, social impact, and philanthropic work. Pleased to have one of global health's most dynamic leaders with us today, Dr. Vanessa Carey.
Thank you. It's a pleasure to be here. And I'm Dr. Vanessa Carey. I am the CEO of Seed Global Health, the World Health Organization's Special Envoy for Climate Change and Health, and a mother of a 9 and 12-year-old.
Today, we're here really to talk about health workers. They are the people that keep our health systems running around the globe. They are the first line of defense against a growing infectious disease situation, NCDs, and countless other preventable and treatable diseases. Yet we don't have enough of them, and we're not investing enough in those we have. The WHO estimates that by 2030, there will be a 10 million healthcare worker shortfall. Today, 3 billion people do not have access to health services within a 1-hour walk by foot. Yet we know that investments in health workers and health care lead to stronger economies for countries. So that's what we wanted to talk about today. And I wanted to start, Vanessa, by asking you, what are the challenges that today's health workers face?
What are the challenges they don't face? I mean, I think that just to start by saying that we know, whether it has been COVID, whether it is climate change, whether it is the cardiovascular disease that one of your parents is suffering from, we are seeing increasing burdens of disease. And we know that investing in strong health systems is critical to being able to meet all of those different burdens of disease. And the leading edge of those health systems are health workers. So you mentioned that we don't have enough. That is certainly one of the problems that we have to solve. But beyond that, it is getting harder for healthcare workers to do their job, especially in the setting of climate change, which is accelerating all disease burdens now. And so we're seeing very directly that it is harder to do your work when you don't have facilities that have electricity reliably because of increasing storms, when there isn't access to clean water, when the bridges are washing out, or when the disease burdens are so high. The malaria season now, at the high season, is no longer 2 patients to a bed in places in sub-Saharan Africa, but 6 patients to a bed. And so the burdens are just larger as we're dealing with. And so one of the challenges is that healthcare workers are seen as a cost. Investing in health is seen as a cost, not as an investment. And yet we know there are powerful, powerful returns on investment when we invest in health. We know investing in a health worker can lead to returns on investment of, for every dollar spent, $2 to $4 in return. We know the social returns can be up 9 to 1. What does that mean? That means safe communities. That means mothers that can take care of their children. It means any number of things that are actually the fundamental underpinnings of strong societies, which we seem to forget in the world that we live in today. And so we need to start reframing our thinking about what this investment can be and the importance of it to this moment in time for our world. And so this is a really important audience, actually, to be in front of as we talk about this, for many, many reasons. All of you have the power to create immense change, but especially from the standpoint of private sector partners, you have an unusual, I think we have a very important ability for private sector partners to get engaged. And so Abbott has done some terrific work, but I want to ask, how can, from your standpoint, what are the ways that we can get our private sector partners more involved in this? Because that is a challenge when we're talking about making these health system investments.
So agree. And business does need to invest in health, and healthcare workers should be at the top of that priority list. I'd like to share some experience that we've had in Tanzania with a really excellent public partnership public-private partnership we've had with the government of Tanzania for 24 years. And when you think about 24 years, you're talking a generation of people. And so one of the messages here is to stick with it, right? But we've invested in infrastructure there. But I will tell you that infrastructure, bricks and mortar, is just an empty shell without the human capacity building that goes along with it. And that's why our partnership has been successful. For example, we've built emergency departments, we've built national laboratories, regional laboratories, outpatient centers. With emergency medical training, we found at the National Hospital that in just 2 years, hospital mortality dropped 40%. Those are people that can go out and earn a living and provide for their family, right? And from that success, we took that and we started a clinical nurses training program. And today, 6,000 doctors, nurses, and health workers around Tanzania are trained in emergency care. We built outpatient centers, but with those healthcare workers are trained. The last time I was there, I saw in a village health clinic, mothers getting maternal care. I saw kids getting vaccines. So that's incredibly important. Vanessa, just turning the tables a little bit, SEED has a really impressive 2030 plan, and it seems like you have 2 goals. One, to build the future healthcare workforce, and the second one is really to advance healthcare workers as a global priority. What has to happen to make this happen?
Oh, my favorite question. We just launched our 2030 plan, and what I love about our 2030 plan, which is it's doubling down on what we've already done. So SEED has spent the last decade training 42,000 doctors, nurses, and midwives that are in service to up to 76 million people in the sub-Saharan African continent. That is, though, not enough when you think about the fact that continent is going to grow to 2.5 billion in the next 25 years, and is seeing increasing burdens of disease from climate change, to which it is incredibly vulnerable, and so there is a need to scale up immensely. Between now and 2030, we're looking to train another 100,000 healthcare workers towards that ultimate goal, to close that gap, who can be in service to the population, have farther reach, and be able to address some of these burdens of disease. But we cannot do that alone, and as much as we know that we are, the way we've designed our strategy is deeply embedded in the country priorities. We are in service to the governments where we work, to Malawi. I hope everybody sees that Minister Chipanda wrote an exquisite op-ed in The Guardian today that really speaks about how climate change is impacting her country. And in that, though, is really the argument of how we need to build strong and healthy systems, and that's part of what we look forward to being able to do. And we're grateful, for example, for Abbott's partnership with us on this, which I'll share a little bit more about in a moment, to be able to help support those goals and to be able to meet some of these burdens of disease. But the things that have to change is, one, we have to see health as an investment, not a cost. We have to mobilize more funding into it. Now, that sounds trite. It's not. We have the resources in the world to solve these problems. It's a question of deploying them and being strategic about looking at the metrics by which we are measuring this. We already lose $8 trillion from air pollution in a year, according to recent data. We are talking about losing money because we are not actually making the investments we need on the front side to prevent those costs. Up to half the US workforce is actually being impacted by the health effects of climate change. But there aren't strategies to protect that workforce. We know productivity goes down by 4% for every degree above 80 degrees Celsius. These are really real impacts on India. So we can reframe this argument. But we have to realize also that more funding needs to go in, because it's just the inequities that we're driving the world today are actually making us unsafer. They're morally wrong, without question. But we are not able to sort of create the safe, healthy communities we need without larger and better funding investments. It needs to be country-led. It needs to be flexible and used in the communities where they know best what the solutions are. And that's very much integral to where SEED strategy is moving. I think it's important to realize, too, that health funding is often very siloed. I will do one disease, you do another disease, I'm going to focus on building this capacity. But all that does is put investments in certain aspects of the health system, but it leaves behind some of the key leading levers of change and resilience like health workforce, which has been underfunded. Only 7% of global health funding has gone to health workforce, and yet they are the most resilient, the most responsive. We have seen this in Malawi, where we're very privileged about, be able to really scale up a partnership with you. We've seen that healthcare workers are delivering babies, but they're responding to malaria, they're managing cholera, they can do it all. They're the single best investment we can make to scale up what we need to do. So we're incredibly pleased to partner with Abbott and to announce this new partnership that we're going to work together to build a center of excellence at the Queen Elizabeth Hospital in Blantyre, which is one of the busiest facilities for delivering children in the country. And what we're going to do is be able to scale up definitive care by building up the number of OBGYNs. Currently, there's only 30 OBGYNs in the country of Malawi, which is 20 million people. Only 21 pediatricians. We are so far below what is deserved. People do not deserve to die because of where they are born. And in 2024, we should all find that unacceptable. So we're incredibly grateful for the ability to build out this project together and to scale it up and to be able to have an impact in a country where you have 20 times more likelihood of dying in childbirth than you do here in the United States. But the multi-year investment that we're going to do is going to make a big difference, because by leveraging training, transforming the quality of care, and demonstrating that through education and training you can actually save lives, will be a very important, I think, signal to the world about the importance of healthcare workers at a time where disease burdens are growing and where the healthcare workforce can be really very responsive.
Nurses and midwives represent 60% of healthcare workers worldwide. So this focus that we're going to have in our partnership is really important. And with additional skills training, we think we can really improve maternal child care. I would just say to my peers in the room that business has every reason to lead here. We know that investments in health lead to economic growth. We know that economic growth and healthier populations lead to more stable societies, and so that is definitely in our interests. SEED is unique in that its sole focus and mission is around the healthcare worker, and so I would encourage you to learn more about their work, not only in Malawi, but in many other countries in Africa. And I would also encourage you to invest in health workers. And I know our organizations will be available to talk with you about that, and really appreciate you being with us today.
I can also add that yesterday we launched a campaign that Health Workers Save Lives, in partnership with the Frontline Health Workers Coalition, to really start to transform over the next year the understanding and the power of the health workforce to help us respond to this moment. We are living in an extraordinarily fractured time, where solving problems is incredibly difficult, but there are some solutions that just make sense. And to your point about the economic growth and security, investing in health is one of the largest sectors in GDPs of most countries. So investing in health and health workers actually is a driver and a creation of GDP. It's a creation of jobs. It's a creation of gender equity. It is a pathway to solving disease problems that are actually undermining and creating sort of instability. And when you look at a fact that climate change is driving patterns of disease and escalating them, whether it is through drought, floods, rainfall, malnutrition, food insecurity, undermining the social determinants of health. There's going to be 1.2 billion migrants from climate change between now and 2050. We're going to see up to 250 million of the internal displacement, and this is at a time where conflict is already rife. So we do truly have a choice. Health is also political. It is our political stability. We have a choice to how we're going to respond to this moment, and making some of these investments is going to start to cool things off. Because when you have healthier populations who are able to seek services, access that physician for the care that they know they deserve, because they can see in the internet where somebody else is getting service, it's going to be a better investment in all of our safety and security. There is a 1 in 25% chance we're going to see another pandemic of COVID-sized scale between now and 2050. That is really significant, being driven by climate change. We need to build our resilience and our responsiveness, and that's what the health workforce and strong health systems can do. So we're very grateful for the ability to come speak about this and to talk about the partnership together.
Same. Thank you.